A new report from Vermont's auditor says the Department of Health's food and lodging program didn't respond to complaints within the required time frame, and they didn't respond to some of them at all.
Our Alexis Crandall spoke to the Department of Health and the state's auditor. She joins us now in the studio. So what did they have to say about this audit?
Well, Brian and Liz, this report from the state auditor is one of 4 being released over the next few weeks, looking at different state agencies and their operations. Between 2022 and 2024, the food and lodging program under the Department of Health received almost 1,100 complaints, ranging from bed bugs to unclean food. A new report from the Vermont State Auditor finding the food and lodging program under the Department of Health failed to investigate over a third of complaints in a timely manner. The audit looked at a sample that included reports from across the state at lodging and restaurants.
We know that the timeliness was an issue for quite a few of them. In fact, from our sample, 7 of the 10 that were serious, they did not get to within 2 days. And one of them that was serious, they didn't get to at all. Now, arguably more importantly than that even is the question of whether they document corrective action.
2 critical allegations were investigated at all by the department. More than a dozen complaints were closed before the department confirmed changes were made by an establishment.
The question is, do they go back to check? And the answer is, in many cases, they don't. Now, maybe they have a relationship. If they've been in the job for a while, they know a lot of the purveyors, the restaurant owners, and so forth, and that's fine, but that's not the same as getting evidence. This has got to be about evidence, particularly if it's a corrective action that's been recommended by the department.
Hofer says the department is open to making changes. His office gave them 8 recommendations, including creating an oversight process to ensure complaints are responded to promptly, establishing a way to track corrective actions taken by an establishment, updating protocol to better guide inspectors, gathering data to identify trends during inspections, establishing target timeframes for closing complaints, and creating quality and performance measures to report to the legislature and chief performance officer.
A lot of them are just looking at our procedures and our timelines that are what we have actually set as goals for ourselves, right? So we have control over managing this, and the big challenge here is just managing our resources and working this complaint response into the broader activities of the program.
Worsing says all of the recommendations are implementable by the department.
We're already in process of implementing many of the recommendations in the report, which only evaluated a small sample of the hundreds of complaints that the department follows up on every year, in addition to that other work. So we're using these audit recommendations to really reflect on our system and make some adjustments that better captures all the important work happening during complaint investigations.
Hofer says his office checks back in a year and then 3 years to make sure the recommendations have been applied. He also noted that none of the complaints they looked at during the audit led to anyone getting sick. The Department of Health encourages folks to continue filing complaints.